The next area of association cortex that we're going to talk about are the prefrontal and anterior temporal lobes. So they're neighbors, prefrontal, anterior temporal. The prefrontal cortex is sort of the last part of our brain that develops as we get into adulthood. So that's why teenagers don't make good decisions. Bear that in mind. If you're a parent of a teenager or a parent of a younger kid who will eventually be a teenager, just say when they're making bad decisions, hopefully you can guide them and remember that their prefrontal cortex is not fully developed yet. So that's my little spiel for that. So we're going to talk about traumatic brain injuries and the symptoms of mild traumatic brain injury and or moderate to severe traumatic brain injury, because that is the area, that is the type of injury that we deal with a lot in therapy that frequently affects the prefrontal cortex. And we're going to talk about emotional lability. So with dementia and memory disorders, there's some degree of emotional lability. There's a great chart in the book that says different disorders and what percent of people with those disorders experience emotional lability. So very interesting, and we'll talk briefly about that. So the association cortex is any part of the cerebral cortex that's not directly involved with sensation or movement. So it's not the motor cortex or the premotor cortex or the motor planning cortex, and it's not any of the sensory cortices, but it's everything else. So it's a lot. It's memory, it's personality, it's decision making, it's social behavior, all that stuff. So the prefrontal cortex is largely made up of association cortex. It's divided into three areas named for their anatomic location. So there's the lateral prefrontal cortex, the medial prefrontal and anterior temporal association cortex, and the ventral prefrontal and anterior temporal association cortex. So basically, it just lays out different areas and different parts of that decision-making, social behavior, and cognitive function happens in different areas of the association cortex. So goal-directed behavior, which is considered executive function, includes deciding on a goal, planning how to accomplish the goal, executing the plan, and then monitoring the execution of the plan. Sounds like what you do every day, right? As an adult, you do that every day. As a teenager, you probably don't because you haven't developed that part of your brain yet. As a person with a traumatic brain injury, they might not be able to do that. They might not be able to perform goal-directed behavior. So the lateral prefrontal cortex has a loop that's called the goal-directed behavior loop. The function of that lateral prefrontal cortex is goal-directed behavior. And goal-directed behavior includes processes of working memory, judgment, planning, abstract reasoning, dividing attention, and sequencing activity. Divergent thinking is the ability to conceive of a variety of possibilities, and it's the lateral prefrontal cortex function. So divergent thinking is really important for problem solving because you can't be cognitively rigid. You have to be able to adapt for what's going on in the individual problem. And that's super important in clinical decision making. So you can go in with all sorts of expectations, but you need divergent thinking in order to adapt those expectations to what's really going on and come up with an appropriate plan. So people with lateral prefrontal cortex lesions are unable to set goals, plan, execute a plan, or monitor the execution of a plan. If you ever work with people who have dementia, wide areas of the brain are affected in dementia, and they might lack this ability. So do you think that person is going to be able to do a home exercise program without someone to help them? Probably not. They're probably not going to be very goal-oriented. Even if you help them to come up with a plan, they're not going to be able to execute it or monitor the execution of it. They're going to need help. Lesions in the lateral prefrontal cortex have little effect on intelligence, as measured by conventional intelligence tests, but they do have an effect on executive function. So, despite the ability to perform normally on conventional intelligence tests, people with prefrontal cortex lesions function poorly in daily life because they lack that goal direction and, most importantly, behavioral and cognitive flexibility. So, that cognitive flexibility is super important for being able to function in daily life and goal direction as well. Emotion is a short-term subjective experience. So when you're angry, you don't stay angry. Maybe some people do, but those people need anger management. But it's a short-term subjective experience. You're sad. You're not sad forever. You're excited. You're not excited forever. Whatever your emotion is, it's a subjective short-term experience. Mood, on the other hand, is a sustained, subjective, ongoing emotional experience. So if you're experiencing depression or anxiety, that's sustained, subjective, ongoing emotional experience. So emotions color our perceptions and influence our actions. They signal the non-conscious evaluation of a situation. And I think probably a lot of us have been in a situation where there's nothing concrete going on that makes you uncomfortable, but there's something that's making you uncomfortable. You like, this doesn't feel right. I need to get out of this situation. So, and so our emotions are giving us a lot of information that's not necessarily concrete information, but it's something that helps us to evaluate the situation. Or like you're looking at houses, you're going to go buy a house, and there's some houses you walk in, you go, nope, like right away, you know that the vibe's just not right. And other houses you go, yes, I could see myself living here. That's totally part of that emotional evaluation of a situation. So the medial prefrontal association cortex is involved in emotions, self-awareness, and motivation. It identifies emotional stimuli and generates and perceives emotions. So it also helps you perceive others' emotions and makes assumptions about what other people believe in their intentions. So can you assume anything about anybody else's emotions? You can't. However, we do it all the time. Just unconsciously, we do it all the time. So part of the way we perceive others' emotions is by their nonverbal communication. So we are going to talk about nonverbal communication and verbal communication in the next section, and it's so interesting. So when you have medial prefrontal cortex association lesions, it can cause apathy and lack of emotions and also lack of insight because we can't perceive nonverbal communication from other people. People report not feeling any emotions, and sometimes it's called anhedonia, which is really the inability to feel joy by definition, but they're just flat, emotionally flat. Abnormal processing in the medial prefrontal corticobasal ganglia thalamic circuit, that's a long one, impairs understanding of others' emotions, beliefs, and intentions. So it's not just our emotions, it's what we perceive in other emotions. We are social creatures. Our brains evolved to be social creatures. And so we put a lot of store in what we're perceiving from other people. So there are 6 structures that recognize emotional stimuli and generate and perceive emotions. And they are the amygdala, area 25, which totally sounds like, area 51. Like aliens there, but area 25, the anterior insula of the thalamus, the medial prefrontal cortex, which we just talked about, the ventral striatum of the thalamus, and the medial group of thalamic nuclei. So clearly the thalamus is very involved in this identifying emotional stimuli and generating and perceiving emotions, as are those other areas, including area 25, the mysterious area 25. Wonder who named that. Wonder if they were just having an off day. Anyhow, there is a loop of neurons neurological loop that links emotion, cognitive, and motor symptoms. It's involved in reward-seeking behavior concerned with finding pleasure. So obviously that's a thing for humans and other animals that have these similar things. So reward-seeking behavior, there it is. Multiple areas of the brain are attempt to control which emotions are experienced and how emotions are experienced and expressed. Voluntary regulation of emotions occurs when a person consciously decides to control his or her emotions. Loss of normal regulation causes emotional lability. So we do this all the time, every day. Like you're at work, you don't want to get all emotional about stuff, so you consciously decide you're just going to chill and not let stuff get to you, right? Um, or in a situation that could become emotionally charged, you might decide like, you know what, I'm not going to get all worked up about this. Um, when you lose that normal regulation, it causes emotional lability. So different brain disorders and traumatic brain injuries and that sort of thing can cause emotional lability. So, by definition, emotional lability is the abnormal, uncontrolled expression of emotions. And it has three aspects. One of them is abrupt mood shifts. So, going from one emotion, whoop, right to another one, abrupt. Involuntary, inappropriate emotional expression in the absence of subjective emotion. So it's just like you just start crying for no reason, or you start laughing for no reason. It might not be appropriate to the situation, but it's involuntary. You can't control it with emotional ability. Um, another aspect of emotional ability is that emotion is triggered by non-specific stimuli unrelated to the emotional expression. So it might be something that isn't specific to that emotion that causes that emotional expression. So basically, your emotions are not under the normal control that they are when you have emotional lability. So take a look at that um, table in the book that shows different disorders and the amount of emotional ability, or the percentage of people with that disorder. People with ALS have a lot of emotional ability because it affects the areas that control that. Alzheimer's, lots of other people, some people with certain CVAs, and certain brain injuries. So, very interesting area. Motivation is centered in the medial prefrontal cortex and the ventral striatum of the thalamus. Ventral striatum activity is essential for increasing the frequency of rewarded behaviors. So, I don't know if you recall from last year, I had a little lecture about time management and study practices. And one of the things, if we reward ourselves for doing something, like we give ourselves a reward, like I'm going to sit down and study for 25 minutes solid without interruption. And at the end of that 25 minutes, I'm going to give myself a reward. If we keep doing that, then our thalamus says, like, hey, I want that reward. So I'm going to do the rewarded behavior, which is studying for an uninterrupted 25 minutes. So we can build that neurochemical response into our brain. Ventral prefrontal cortex lesions affect a lot of things. So making good decisions depends on a balance between emotional, impulsive, immediate systems centered in the amygdala and the lateral prefrontal rational cortex. So people with lesions in the ventral prefrontal cortex have intact intellectual abilities, but often use poor judgment, are impulsive, and have difficulty conforming to social conventions. Interesting. Um, in lesions that affect the somatic marker circuitry, poor judgment and defective social intelligence cause severe problems in social function, employment, interpersonal relationships, and social status. So, a lot of times, if people have brain injuries, they have difficulty in all those areas. Social intelligence depends on integration of information from structures that process emotions with analytic information. Goal-directed behavior requires the lateral prefrontal cortex and the parietal cortex, but social intelligence requires the ventral prefrontal cortex, which is like the bottom part of the prefrontal cortex. So because in development, the brain takes a 90-degree turn. Dorsal becomes the top of the brain and ventral becomes the bottom of the brain. Whereas in the spinal cord, dorsal is the back and ventral is the front. So there's that little 90-degree turn there. But so different areas of the cerebral cortex contribute to goal-directed behavior and social intelligence. In traumatic brain injuries, they are mild in 80% of cases. So, what is the other name for a mild traumatic brain injury? It is a concussion. So, when you have a concussion in sports or whatever other reason you have a concussion, it's a mild traumatic brain injury. Most moderate to severe traumatic brain injuries occur in motor vehicle accidents. Severe traumatic brain injury causes approximately 10% loss of brain volume in the first year after the injury, and white matter loss continues for up to 8 years after the injury. So, with a severe traumatic brain injury, the effects can be progressively worse. People with traumatic brain injuries, particularly severe traumatic brain injuries, show poor judgment, decreased goal-directed behavior, memory deficits, slow information processing, attentional disorders, and poor divergent thinking. With mild traumatic brain injuries like concussions, they can be cumulative if you don't have enough time to heal in between. So it happens a lot in sports where someone gets a concussion and then they return too soon, maybe they get another concussion and the effects are cumulative. So that's a big concern in children and adult sports. And there's a lot of focus on it, which is good. We have a concussion team at the clinic where I work, and I'm on the concussion team. And it's a very interesting area. It's definitely something, if you're interested in treating people with concussions and post-concussion syndrome, it's an area where you'll go and get continuing ed. There's certifications you can get, and there's lots of interesting stuff going on in concussion treatment. So the majority of moderate to severe traumatic brain injuries occur in motor vehicle accidents, like I said, and the impact tends to damage the orbitofrontal anterior and inferior temporal regions to cause diffuse axonal injury. And so when you crash into something or something crashes into you with a car, your brain gets jostled forward and backward. And so that's what causes the damage. That acceleration, deceleration injuries cause diffuse axonal injury and give you the effects of traumatic brain injury. So traumatic brain damage in infants is most frequently attributable to axonal falls, but brain damage consequent to most falls is relatively minor because babies are small and they don't have that far to fall unless they fall down the stairs or something. But no, don't let your baby go near the stairs. But more severe brain injury usually requires greater force than a typical fall for a small human, and forces that are sometimes generated when an infant is violently shaken. So trauma from shaking is due to the impact of the brain striking the skull. So just like in a car accident where the brain goes forward and hits the front of the skull and then backwards and hits the back of the skull, if you shake a baby, the same thing happens to their brain. So don't shake your baby. We all know that. But there you go. That's how brain injuries happen with babies, either falls or being shaken. Not good.